It is 8:13 on this Thursday morning, March 25th. It's warm outside. Feels like summertime. It really does. Windy. A chance for some severe weather later on, but primarily they think it's going to be not so much of a rain event, but just a lot of wind. And they're saying, as you heard on the weather a couple of minutes ago, maybe winds of up to 40 miles an hour, which means you could have some branches down or even trees, I guess, at 40 miles an hour if they're rotten. And then before you know it, power's out, etc. So be aware of that. It is 73 and muggy is all get out in Belle Chase. It is Thursday morning in the 8 o'clock hour, and that's when we talk to our friend Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. And it's good to talk to you again, Dr. B. How you been?
Hey, I've been good, Tommy. How about you?
Ready to dry out.
Yeah, it is a little sticky out today, isn't it?
According to the weather, weather-wise, dry out, just to be clear about that. According to the American Cancer Society, colon cancer is the third most common cancer among men and women in the United States. And in honor of Colon Cancer Awareness Month, Dr. B from People's Health is going to talk about preventing colon cancer. And it's the kind of thing, Dr. B, that can make people maybe uncomfortable to talk about, but you need to talk about it because it's very serious.
Yeah, definitely. Colon cancer is, highly prevalent in Louisiana, and really the key is finding it early if you want to actually be able to treat it appropriately.
And if you catch it early, the survival rate is pretty good, right?
Yeah, definitely. We can definitely treat the cancer once it's found, and if you find it early, the survival rate can be as high as 90%. And, the problem here in Louisiana is that typically we find colon cancer later, at a later stage, and that's why we rank number 4 with the highest mortality rate in the country from colon cancer.
Wow. It is preventable, though, by... I don't know. How would it be preventable?
Yeah, it's preventable, treatable, and curable. The reason we say it's preventable is because there are things that we can catch early before they become truly cancerous. And if we identify those things, then we can actually start treatment earlier and really stop the progression to cancer. If we find a small tumor, then we actually have a lot of very effective agents and therapies that we can use to actually treat cancer. But what's really important is getting checked, and you don't want to wait because perhaps you're afraid of the testing methods. The CDC has done a lot of studies on colon cancer, and really they're showing that we have extremely low screening rates, and so less than 40% of colon cancer is found early, and the rest is found in a later stage. One of the things I worry about so much is, the effects of the last year during the pandemic. People stopped going to the doctor, and therefore they stopped getting screened for colon cancer and other types of cancers like breast, for example. And so, estimates right now are that we could see up to 10,000 extra deaths from colon and breast cancer over the next 10 years simply because we didn't identify them early enough to treat and cure them. So it's really, really important that you continue getting your screenings, go to your doctor's appointment, talk to your doctor about what you should be having done, because that early diagnosis just makes a huge difference in your treatment and prevention of cancer.
So how often should you be screened?
So right now, the official recommendation is that everyone, men and women, should be screened for colon cancer after they turn 50. There's going to be some news coming out pretty shortly because there's been a lot of discussion over the last few years about possibly lowering that age to 45. Usually we take our cues from the U.S. Preventative Services Task Force, and they've actually had an open discussion over the last year about lowering that age limit, and the final recommendation should be coming out in the next couple of months. So 50 right now, but it could be a little bit lower. And then the other thing that's important is talk to your doctor, because there are some increased risk groups or conditions that you may have where you need to be tested earlier than 50. So you want to talk to your doctor about that, because they'll let you know, if you need to go in a little bit sooner. And there's several different tests that can be done as well. Everybody knows about colonoscopy. That's really the gold standard. It not only allows us to identify cancer, but in certain cases, precancerous polyps that we can remove during the colonoscopy as well. But there are other tests that you can get done. You can do something called a fecal occult blood test, which can even be performed at home. So you want to talk to your doctor to figure out really what the best test is for you. And then if you're diagnosed with cancer, there are a lot of treatment options available. So don't let that fear of being diagnosed, lead you to not identify the cancer or kind of close your eyes to that, because there are a lot of things we can do if we find it early enough.
And again, going back 90%, right? If you catch it early, chance of curing it.
Exactly, and that's what's really so important. If you can get into that early screening, then really we can eliminate the cancer, and it's not going to be a problem for you.
All right, let me take a quick break. When we come back, we'll talk about who's at risk. We'll talk about smoking, symptoms associated with colon cancer, and in addition to getting screened regularly, are there other tips for prevention? And I know you guys are having a colon cancer presentation today at 10 a.m. that we'll talk about, and it's absolutely free. 8:20, time for traffic now on WWL. 8:23, Tommy Tucker, WWL. Thursday morning, that's time for People's Health. Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. Talk about senior health. So, Doc, we're talking about colon cancer. Who is at risk for it?
Sure. So, like we were saying, the majority of cases of colon cancer, probably about 9 in 10, happen in people that are 50 years or older. But really, any age group could be at risk for colon cancer. And a couple of things we look at, African Americans in particular do have a much higher risk of colon cancer. And interestingly, Eastern Europeans do as well. And Cajuns in Louisiana, so over in the Acadia area, they actually have a very high risk of colon cancer. So it's something to think about, especially if you've had anyone in your family who's had either colon cancer or any type of cancer, or maybe even just colon polyps, because those are usually the precursors to cancer. So those are people that want to talk to their doctor to maybe come up with a plan to get screened a little bit earlier. There's a couple of other groups that are not quite as common, but anyone who has something called inflammatory bowel disease, and that includes Crohn's disease or ulcerative colitis, those individuals are at much higher risk for colon cancer. I mentioned anybody who has polyps, so if you or anyone in your family has ever been diagnosed with colon polyps, that's also another risk factor. And then really any types of cancers, colon cancer can happen with some of the same changes that happen with breast cancer, ovarian cancer, even uterine cancer. So if you've had another type of cancer, it's real important to get screened for colon cancer as well.
I know people don't want to hear it, but it always comes back to smoking.
Yeah, always. We can't say it enough. Smoking causes all sorts of problems, and colon cancer is not accepted from that. There's been a very direct link made between smokers and colon cancer rates, and they're much, much higher. In addition to that, though, also people that consume large amounts of alcohol. So a lot of drinking can actually lead to polyps and colon cancer as well. And then in particular, diet, especially a diet that's really high in red meat or processed meats, those are things like lunchbox meats. That can actually lead to colon cancer as well. And then we've also linked it to really just being overweight or obese or living a sedentary lifestyle, not being active enough. That can increase your risk. And there's even an association as well with diabetes, which, as we know, is very common in Louisiana.
We talk about early diagnosis. Are there always symptoms associated with colon cancer?
There aren't, and that's what the problem is and why it's so important to get screened, because really most often, especially if you're in the early stages of colon cancer, there's absolutely no signs, that you can actually see. And so, again, that's why it's real important to get screened for this. As the disease progresses, if you actually do have colon cancer and the tumors begin to grow, usually the most common thing that you see is a change in your bowel habits. And so that could be either, loose stool. It could be actually some problems with constipation. It's never normal to see blood in your stool, so that's something you always want to talk to your doctor about as well. And then definitely if you start developing problems like nausea or vomiting, real frequent cramping, that's very concerning. And then one of the most common things we see in late disease is actually weight loss. So if you're not actually trying to lose weight and you start dropping a lot of weight, that's a red flag, and you want to talk to your doctor about that right away.
So in addition to regular scanning or getting screened regularly, what are some other things you can do to prevent colon cancer?
Yeah, it's very similar to a lot of medical conditions. You want to live as healthy a lifestyle as you can, and that's really going to prevent colon cancer along with a lot of other cancers, and probably also help you with heart disease and diabetes and a lot of other problems that we see. So what's important is have a really good diet, reduce the amounts of red meat that you're eating and processed meats that you're eating. Eat more fruits and vegetables. Fiber has actually been shown to be preventative for colon cancer as well. So diet is really important. And, staying active, maintaining a healthy weight, like I said, obesity is linked to colon cancer. So if you can keep your weight at a healthy level, you're less at risk. And, that's going to help you with your cholesterol and your blood pressure as well. And I can't say it enough, we just mentioned it, but quit smoking. Smoking, like I said, is a direct risk factor for all types of cancers. And so if you're smoking right now, you really need to quit, and that'll help reduce your risk for a lot of future health problems.
And you guys got something going on, and you don't have to wait long to take advantage of it because it's happening today, right, Doc?
Yeah, we do. We actually have a great presentation that we're doing on colon cancer awareness, and it's today. It's actually this morning at 10 o'clock. It's a free event, and it's virtual, so you can log on right from home. You can actually just sign up for the event at peopleshealth.com/wellness and kind of join us and learn a little bit more about colon cancer, what the screening protocols are, and get a chance to kind of have some of your questions answered as well.
And you can even do it in your pajamas if you want, right?
Yep, that's right.
All right, thank you, Dr. B. Good talking to you. Have a good weekend, all right?
Thanks, Tommy. You too.
If you want to find out, you too, sir, if you want to find out more about People's Health, you can go to peopleshealth.com/radio. You can call them at 866-687-7335. And you can always follow People's Health on Facebook, Twitter, and Instagram. But that colon cancer awareness event is today at 10 a.m. You can sign up for it at peopleshealth.com/wellness. 8health.com/wellness. 8health.com